Cognitive and physical decline make oral hygiene maintenance difficult, fostering a vicious cycle where worsening oral health impairs cognition and chronic disease management. Poor cognition or difficulty brushing teeth can lead to neglect of oral care, increasing infections and inflammation, and accelerating the underlying disease process. So let's just unpack this. If you've got somebody who has cognitive decline, for whatever reason, maybe it's oral related, maybe it's not. They've got cognitive decline and they keep forgetting to brush their teeth. Then they're going to start developing bacteria and all kinds of other stuff. They're eventually going to get gingivitis or some sort of oral infection. And that's going to contribute to more inflammation, which is going to worsen their cognition, make it even harder for them to remember to brush their teeth. We also have people who have difficulty, whether it's Parkinson's or arthritis or something else, have difficulty engaging in the activities of oral care. Brushing their teeth, that fine movement, holding the toothbrush, can be too difficult. And they're using mechanical toothbrushes can be helpful. They're more ergonomic. They have a much wider body for you to hold on to. Using water picks for flossing teeth, because flossing, I don't care what age you are, that's just awkward. It's just awkward. And if you're having difficulty with your fine motor movements anyway, flossing's probably the last thing you want to do. And if they've already got inflammation and gum disease, it may be painful to floss, whereas the water picks generally are not nearly as painful. Work with their dentist. Have them work with their dentist. Chronic conditions like diabetes, cardiovascular disease, and respiratory illnesses share risk factors with poor oral health, mainly inflammation. All of these chronic conditions have an underlying factor of inflammation, which means that all of these underlying factors make it more likely that the person will also develop oral inflammation and oral health deterioration, which is going to increase the deterioration of their overall health. So what can we do? We're not dentists. We're not going to be brushing their teeth for them most of the time. Now, some people may have caregivers that do brush their teeth for them. But what can we do to help people maintain their independence and maintain their oral health? Push notifications on their mobile devices if they have one. If you're in a facility that has Amazon Echoes or something else in every room where you can push out a notification to every resident at 6 o'clock in the afternoon, push out a notification. Don't forget to brush your teeth. If they don't need that reminder, they'll just ignore it. If they do need that reminder, then it'll be like, oh, okay, thanks. Use ergonomic electric toothbrushes. Have them try different ones. Some have bigger bodies than others. Figure out what feels comfortable in their hands. But when you use those, the vibration of the toothbrush takes away the need to do this, which can be very difficult for somebody who's got mobility issues. Use water flossers, as I mentioned. Rubber dental picks. They have little, it looks like the cleaners that you use to clean straws in the kitchen, but much smaller, where it's got a little rubber tip with little tiny fingers protruding from it that you can use to put between your teeth. Now, it doesn't get up where the teeth are really tight together. It's not as good as dental floss, but it can be helpful. Something's better than nothing, right?